to welcome you. I'm Maria Royce. I'm the Vice President of Community Relations at WellSpan. And more than a decade ago, WellSpan embarked on a plan to make healthcare more convenient for our communities, for York and Adams County. And one of our visions is that our physician offices would be 10 minutes from a person's home, wherever they live. So today we are really pleased to announce the next phase of convenience care for our community. But before I turn this over to our speakers today, I'll just say personally, it's not soon enough that we have this new care available. It was just ironic knowing that we were making this announcement today that I woke up this morning and my 12-year-old had an ear infection. And we spent the 2 hours prior coming to this announcement getting care for him. And I really thought that having our new CareExpress clinics would have made getting that care just much more convenient. So I'm going to turn the podium over to Tom again. Tom is a Senior VP at WellSpan, and he also heads up our WellSpan Medical Group. Our WellSpan Medical Group represents more than 500 physicians and healthcare providers in York and Adams County. So, Tom again.
I'd start with primary care. We know that we have access problems with primary care. WellSpan sponsors 30 practices of primary care services, and patients have trouble getting in for appointments. And it doesn't seem to be getting any easier to make that better. Secondly, the demand is increasing. The baby boomer generation is hitting 65. As you know, as people age, they consume and need more healthcare services. And secondly, we have a shortage of primary care physicians. In York County, the average age of our primary care physicians is in the early 50s. And we have probably 20 or 30 physicians over the age of 60. And how are we going to replace them in this time where there's more demand? You counter that with the consumer side, and through our research, we know that consumers want their primary care services for low acuity, less serious problems. Quick. They need it now. They need it when they want it. They want it in a convenient location. And other parts of the country, it has been shown that having these types of services in grocery stores is a very, very nice mix that the consumer likes. The other piece of it is that we've had within WellSpan a strategy around this area for many, many years. And this is just a nice augmentation of what we're already doing at the Ready Care on East Market Street in York and the WellSpan Orthopedic Injury Walk-In Center at Apple Hill Medical Center in New York. Lastly, providing this access to walk-in care within an integrated health system seems to make a lot of sense. There are competitors who are freestanding and who are not linked to health systems. We think it's an advantage for the people in this area to have these services sponsored by an organization that they know and trust for many, many years. So we're very pleased to get into this type of arrangement. For all of the patients of the area, this will improve their access for low acuity visits. For WellSpan Medical Group patients, it even is a tighter linkage because the electronic health record will be available here in the store, and the patient's entire record will be available to the provider that's here, which is a very nice continuity of care issue. So in the details of the types of things that we'll see here, I'd like to introduce the medical director of these services, Dr. Eugene McElwee.
Well, you would be providing supervision to the staff here at retail clinics. The retail clinics will be staffed by mid-level providers, so they'll be certified nurse practitioners and physician assistants. And their role is to provide what we would consider convenient care, but for those things that are minor illness and injury. So that would be things like your ear infections, as Maria discussed, sore throats, minor sprains, poison ivy. They'll also provide sports physicals and camp physicals and those types of things. The nice thing is that it's a lower acuity of care. It doesn't require emergency room type of treatment. Our hours will be typically from 8 till 8 during the week, Monday through Friday, 9 to 6 on Saturday, and then 10 till 4 on Sunday. And the nice thing is that we'll have the pharmacy on site here, so that makes it convenient as well for the patients to be able to get medications they might need. And this is Mr. Brandt, who's Giant.
I want to, of course, welcome WellSpan into the Giant family, if you will. It's a great partnership, and we're looking forward to working with them. And as Gene had mentioned, it really doesn't get any better than 8 to 8, Monday to Friday. I mean, that's talk about convenience for our customers. And that's really what the benefit is all about for our customers. We feel that we are about choices. Giant provides choices in all the beautiful variety of different merchandise that you see here, all the products that we give. But we also feel that it's all about choices, not only from a product standpoint, but also from a resource standpoint. And it's over the years, our pharmacists have been great resources for the community in terms of healthcare. But this takes it to a new level. And to have WellSpan here in our store in conjunction with our pharmacy team, I think that really makes a great and appealing choice for our customers. So we feel it's a great fit for our customers. Our customers are very busy. They're very active. They are families, and for them to be able to say, you know what, maybe I have, my child has, maybe there is an ear infection, maybe there is a sore throat, but you know what, I don't have the time to chase around my pediatrician on a Saturday afternoon to figure that out. So to have them here at Giant already, and to have WellSpan providing that service, we think that's a win-win for everybody. So I just want to welcome WellSpan, and at this point, I think if there's any questions, we'll certainly be happy to field those. So Maria, I don't know if you want to take the podium again or answer any questions.